So what is hypnosis? Well, how many of you have been hypnotized? Any of you? Okay, so correct me if I'm wrong. There's a substantial amount of experience here. I think of hypnosis as a state of aroused, attentive focal concentration with a relative constriction of peripheral awareness. So hypnosis is to consciousness what looking through a telephoto lens is to a camera. You see what you see with great detail, but you're less aware of the context of the surroundings. So this profound absorption is a part of hypnotizability. And the people who are more hypnotizable tend to use it all the time. So how many of you have had the experience in a movie of getting so caught up in the movie that you forget you're watching the movie, you enter the imagined world? How many of you have that? How many of you have never had that experience? You don't know what I'm talking about. Okay, so it's about half and half, and you guys can leave now. In fact, that's associated with a trait called absorption, the tendency to lose yourself, to have self-altering experiences. And the first group of you are more hypnotizable than the second. And hypnotizability is a very stable trait. People have it it's as stable as IQ throughout adult life. So those people who have it get fully absorbed in what they're attending to. And then there are two other things that go along with it. One is what we call dissociation. So it means that you put out of consciousness things that would ordinarily be in consciousness. Now our brains process vast amounts of information automatically. The brain is a huge information processor. But the things we're aware of, when we're thinking, reflecting, making choices, that system is a much more energetically expensive system, and it can manage only about 7 plus or minus 2 things at a time. The famous experimental psychologist George Miller wrote a paper called The Magical Number 7 plus or minus 2, and he didn't like magic. So the fact that he used that word caught people's attention. And what he was saying is that in every study of working memory and attention, you can remember between 5 and 9 things, which was actually how Bell Labs came up with the number of digits in a phone number, that you could remember about 7. 10 is kind of pushing it for us, and that's why we all have them recorded on cell phones and don't know our own home number anymore. So in hypnosis, you're down at the lower end. You're focusing on fewer things. You put out of consciousness things that would be in consciousness. And is this a kind of weird thing? Well, let's do a little experiment. Right now, you're having sensations in your bottoms touching these wonderful chairs the school has provided for you. Hopefully those sensations were not foremost in your mind at the time I brought it up, or if they were, you could leave now. So all the time we're deciding to pay attention to some things and put out of conscious awareness others. Hypnosis is a more extreme form of doing that. Now the third thing that happens with hypnosis is what's been called suggestibility. The idea that you will just rotely go ahead and do anything anyone tells you to do when you're in this altered state. And when my patients used to anxiously ask my father, he was a psychiatrist who practiced hypnosis since World War II, they'd ask him nervously, can you hypnotize me and make me do anything you want? And he would say to them, if I had that much power, do you think I'd be wasting my time sitting here talking to you? So he converted anxiety into anger that way. And on the one hand, no, you can't, people can refuse to do something suggested to them. On the other hand, I think we've all had that it seemed like a good idea at the time experience where you thought, what was I thinking when I went along with that? So in order to make judgments, you have to compare and contrast. You have to be in a frame of mind where you're thinking about the implications. AA calls it thinking through that next drink. Think through what it means if you do it. And if you're in a kind of frame of mind where you're less likely to critically judge and evaluate, you're more likely to do it and worry about it later. And that does happen in hypnosis. So while anybody can refuse to do something, it is the case that people who are hypnotized are more likely to go along. Now, there are sort of dark implications of that if it's misused. On the other hand, there are positive therapeutic applications. A lot of people have a million ways of defeating the cleverest therapeutic strategy you've just cooked up. And if they're in a state in which they're less likely to do that, they're more likely to go along with and act upon the instruction you give. So this altered mental state can get people to focus intently on a good therapeutic strategy, to put outside of awareness things like pain that they just as soon not pay so much attention to, and to give up their habitual ways of defeating efforts to get them better. So I want to show you some examples of that. In a sense, hypnosis gets us to reverse the way in which we usually use our brain. And I'll give you an example of this. Typically in ordinary consciousness, for example, we respond to perceptions and manipulate language. And we're doing that right now. I'm manipulating language, you're responding to perception. So I'm in a more active mode, you're in a more passive mode. If you look at the brain, one really simplistic way of thinking about the brain is just divide it front and back, okay? And in the precentral area here, you have most of the parts of the brain that enable us to enact things upon the world. You have the motor cortex here. You have the frontal lobes, where we make decisions and plan what we're going to do. And you have the anterior part of the temporal lobe, which is where the speech centers are. The back part of the brain is the sensory receptive part of the brain. So you have this huge occipital cortex where we process visual information, somatosensory cortex here, and auditory cortex here in the posterior part of the temporal lobe. So the back part of the brain is where we respond to the world. The front part is where we act on the world. And what you do in hypnosis is you invert that a bit, because in hypnosis, we respond to language rather than use it to change the world, and we can manipulate perception. So we take a more active stance about parts of our experience in which we're usually pretty passive. And that's one of the things that I think makes hypnosis such an interesting phenomenon. Now, you may wonder, why on earth would humans be evolved to do that? Well, think about the fact from an evolutionary point of view that as physical creatures, we're pathetic. You know, we're not very big, we're not very fast. Eagles see better than we do, dogs hear and smell better than we do. And about the only sort of physical advantage we have on the animal kingdom is the opposing thumb, which is a good thing, but you know, it's got its limits. So what that means is that we're more often creatures of prey, and the way prey detect their victims is motion. So if you've evolved in such a way that even if you're scared or hurt, you can put out of awareness things that would tend to stir you up and keep yourself still, you have a better chance of surviving. So there's a lot of evolutionary theory that thinks we have evolved these states of consciousness to help ourselves survive in situations where we otherwise might not. So this is another example of exactly that. So how can you get through your medical care being treated like Saint Sebastian and still have a smiley face? Well, I'll give you a number of examples of that, how we've used hypnosis to do this. So, you know, we tend to think in a very bottom-up way about things like pain perception, for example. Have you ever had the experience of stubbing your toe on a door frame or something, and you think, oh God, this is going to hurt? And it takes about, you know, 2 or 3 seconds, and then it hurts. Well, now, why the delay? The reason is that there are 2 peripheral neural systems that transmit information. And one of these large alpha fibers that are well myelinated, you've heard about myelinated neurons and things like that. Well, anyhow, they speed conduction of impulses, and they detect position and vibration. And so when you juxtapose your toe with a hard object, you know right away you've done it, because the position sense gets to your brain quickly. The fibers that carry pain perception are smaller, they're not well myelinated, and they conduct impulses more slowly, and they go by a different path, what's called the lateral spinal thalamic tract, up to the thalamus and the periaqueductal gray in the brain. And so that's the second signal that gets to you. We tend to think that the amount of pain we feel is just the product of all of this noxious input that comes up. But for decades, there has been research that shows that in fact pain is a bidirectional experience, and that we can alter our perception of pain. Even Pavlov noted this, that after a while you give the same shock to a dog and they stop reacting to it. That the downward input from the cortex can actually modulate the amount of pain you feel. The way you can remember that is that the strain in pain lies mainly in the brain. You have to pay attention to pain for it to hurt. And here's an example of that. See, here's the pain stimulus. Little Mary here looks kind of interested, actually, and her father is in terrible pain. So, and you know, many of us know athletes who broke their ankle in the second quarter of a football game and didn't know they were hurt until, you know, halftime or something, when somebody said, "What's wrong with your ankle?" Pain is a combination of the physical input and the amount of attention you pay to it. But pain can hijack attention. So let me give you some examples of how we can use hypnosis to help people deal with it. And I'll just tell you one case example before I tell you the study. I was called by a famous oncologist here to see a young man who was a world-class swimmer who nearly died one night. He bled out. He had a grapefruit-sized lymphoma. That's a white blood cell tumor in his gut. And he nearly died. They brought him in the hospital and started him on chemotherapy. And he was literally climbing the walls. I mean, literally, he was in so much pain, he couldn't stand it. His parents were afraid he was becoming a drug addict. And so when they run out of things to do, that's when they call me. So the drugs weren't working, so get Spiegel in here. So I told the parents, I'm not worried about drug addiction. That's low on my list. Let me deal with him. So I go in the room. This huge strapping guy is struggling on the bed, moaning and screaming. And I said to him, trying to establish rapport, we learned that in psychiatry, I said, you don't really want to be here, do you? And he said, how many years of medical training did it take you to figure that out? So I could see we were getting along very well. And I said, well, where would you rather be? And he said, well, you know, I'm a great swimmer, but I've never surfed. And I said, okay, we're going to Hawaii. So I got him hypnotized, and I told him to imagine that he was surfing. And he kept groaning, but the groan changed a little bit. And I said, what happened? And he said, well, I fell off the surfboard. And I said, good, well, get on it and do it right. So I got him practicing surfing. Just don't be here. Go somewhere else where you'd rather be. 48 hours later, I was back on the unit. He was in the hall in bear claw slippers, chasing the nurses up and down the hall. He was off his pain meds. And I got to the note from this famous oncologist who wrote, patient off of pain meds, tumor must be regressing. So, you know, we're sort of the Rodney Dangerfield of medicine. You know, we don't get no respect. This is a paper that we published in The Lancet in 2000. Elvira Lang, who was a radiologist here, is now at Harvard, and I built up a collaboration over a number of years. And it's one of the wonderful things at Stanford, where there's just terrific people around that you can build research collaborations with. And she came to me to learn to use hypnosis, which she called allodyne imagery, but we use hypnosis to help patients who were going through invasive radiological procedures. Now, these are procedures where they do arterial cut downs, they thread little cameras to visualize the constriction in the renal artery or to do embolization of tumors in the liver and elsewhere. And you don't use general anesthesia. It's a lengthy procedure, 2 to 3 hours often. There is substantial pain and anxiety involved with it. So we randomized patients to 3 conditions. One, standard care. All the patients had IVs, and they could push a button and get what's called patient-controlled analgesia, so they could give themselves a dose of opiates. Another third had that plus structured attention, so they had a kindly nurse who was there just kind of holding their hand and helping them. And the third group was taught self-hypnosis to do the kinds of things I'm talking about here, where you imagine that the part of your body that hurts is cooler or warmer, or you just go somewhere else, or you focus on sensations in another part of your body. But you use this constriction of attention to focus on something else and filter the hurt out of the pain. So these were the 3 conditions, and here's what happened. You see here the pain scores on a 0 to 10 scale. And one of the things, it's very important, if you're in pain, make sure your doctor asks you to rate your pain on a 0 to 10 scale. It's very hard to communicate how much pain you're in. And either people overmodulate and say, I'm fine when I'm not, or they undermodulate and they rant and rave, and then people don't take them seriously either. So using a numerical scale like this is very helpful. So these patients rated their pain, and you can see that by the second hour, the standard care patients were starting to lose it. Their pain was going up and up. It was 6 out of 10-point scale. By the third hour, it was 7.5. So they're getting worse and worse, despite giving themselves considerable amount of analgesic medication. The ones who were getting the supportive care were staying about the same. They were doing okay. The hypnosis patients were actually reporting less and less pain as time went on. So it was down to 1 by 2.5 hours after the study had begun. The anxiety scores actually started to worry me because, again, the standard care patients are getting more and more anxious. The ones with the nurse paying attention to them were staying about the same, and I was afraid the hypnosis patients had all died because they had no anxiety at all by the end of 2 hours. They were doing fine. So you see dramatic differences over time in the pain and anxiety these patients felt, all undergoing the same kinds of medical procedures. And the interesting thing is that the hypnosis patients were using half as much medication, half as much pain medication as the other groups were. So they had less pain, less anxiety, and used less medication, and the procedures on average took 17 minutes less time. So, and part of it was less wear and tear on the medical staff, who didn't feel that they were causing all kinds of pain to the patients. It turns out actually that even adding the extra personnel to do the study, you saved an average of $348 a procedure because there were fewer complications and it took less time to do the procedure. There was far less problems with oversedation, with problems with blood pressure in the hypnosis group than there were in the other 2 groups. So this was a situation in which a very simple, straightforward intervention helped people get through the procedure quicker, more safely, and with less pain and anxiety. Now, when I said the Rodney Dangerfield of medicine, if you had a drug that did this, I can assure you that by now every hospital in the world would be using it. This wasn't a drug. This was teaching patients self-hypnosis, published in one of the best medical journals. People are starting to use it. There's more use of it, but it is anything but standard care. I'll give you another example. This is, my daughter Julia drew this when she was a good deal younger. She said, my dad hypnotizes people and makes them want to live longer, and you see a particularly successful clinical example here. And Julia, who's now a student in law school, says, Dad, are you still showing that thing? And I said, so I have to tell you that this doesn't represent her current level of artistic ability. I was getting calls from Packard Hospital that they were having physical struggles with 8-year-old girls in the radiology suite. And could I help them deal with it? So I thought, well, yes, this is worth looking into. And it involved what's called voiding cystourethograms. And these are studies where you have to stick a catheter in through the penis or the urethra into the bladder, instill it with radio-opaque dye, and then have the child void to see whether there's backflow up into the kidneys. Because the bladder and the ureters that go into the bladder are actually very cleverly designed most of the time. And that is, if your bladder is like this, nice and round, your ureter goes in like this. And what that means is that when you start to urinate, it naturally closes the ureter. It's a natural valve so that you don't get pushback of the urine into the kidney. But some children are born with it perpendicular, and that means there is pushback, and you can lose your kidney. So you have to image them every year and see whether they're going to grow out of it naturally, or you have to do major surgery. The kids remember this, and sometimes the parents lie to the kids and say, we're going out for an ice cream, and the next thing you know, they're in the hospital with strangers doing this to them. It isn't good. So we got them. I would see the child and the mother a week before the procedure. I'd hypnotize the child and have them, I'd say, where would you rather be? And so they would be Disneyland or playing with a friend or in a park. And we'd make a list, and the mother would practice with the child every night. And when we got to the suite, the mother would be behind the head, I'd be by the right shoulder. And between us, we would keep the child distracted doing self-hypnosis. We now have developed some DVDs that we give to parents to help them do it. And so we had a randomized study where half the kids got routine care and half got this self-hypnosis training. And you can see that there was significantly less crying during the procedure. And we had them rate how uncomfortable, unhappy they were. The children reported less distress, particularly during the catheter preparation, which is the worst time, and inserting the catheter. The techs who were there the whole time thought it was twice as easy to do the procedures. And again, that's 17 minutes. It took 17 minutes less time per procedure to do it, and that's a long 17 minutes with an 8-year-old in a radiology suite. So again, we were able to show and publish in Pediatrics that simple self-hypnosis can make a huge difference in how comfortable it is for children to go through these procedures. Now I'll give you a third example of how we've learned to use hypnosis. This is the smoking gun, and we know that smoking is a major public health problem. I think it's really remarkable that there are whole industries devoted to getting people hooked on substances that have no real virtue except to kill you with emphysema or lung cancer, not to mention the effects on your children. And so we developed a technique, and my dad was a pioneer in this area. It was a very simple self-hypnosis technique. A lot of people say, I want to start, smoking at least gives me an opportunity to take a few minutes for myself. Now, of course, you're putting poison in your lungs while you're doing it, but, So I say, well, you know what? You can feel good, take a few deep breaths, teach your body to float without poisoning yourself at the same time. That's called self-hypnosis. So we teach them to do self-hypnosis and concentrate on 3 points. For my body, smoking's a poison. I need my body to live. I owe my body respect and protection. So you focus on what you're for, on thinking of your body as if it were a trusting, innocent child, and protecting it from damage rather than being against smoking. And one thing that people who use hypnosis are pretty good at is figuring out what not to say to patients. Try this. Try not thinking about purple elephants. Don't think about purple elephants. Well, what are you doing? You're thinking about it. If you tell somebody don't do something, you're actually forcing them to be tempted to do it. And instead, we're saying focus on what you're for, not what you're against, and hook in your behavior about smoking to all the other sensible things you do, like buckle your seatbelts and look both ways when you cross the street and eat carefully and all that. So you connect it with a network of associations that help people to focus on this. And I have to tell you one other story about my dad. There was an article in the Times about him and the Wall Street Journal and a blog. People started collecting stories about him. And one guy said, I went to see Herbert Spiegel 20 years ago, and I'd been smoking for 8 years. I couldn't stop. And he put some headphones on and he said some things to me, and I left his office and I lit up a cigarette and it tasted just as good as it had before, and I thought I just wasted $200. He said, that was the last cigarette I smoked in 20 years. He said, I don't know what he did to me, but it stopped. And as a matter of fact, we get half of the people we see for just one session to stop, and half of them will not touch a cigarette in 2 years. So if they have a single cigarette, it's classed as a failure. So it's not bad. I figure that's the best use of my clinical time that I make. If I can get 1 out of 4 people never to smoke again, teaching them self-hypnosis, I'm happy. So these are some examples of how hypnosis can help people, how you can use the mind to influence our brain and behavior, change the way we process pain, and change some of our behavior. And there are lots of other examples of this.